And welcome to Health Equity Zones Initiative Overview Session for January 26, 2023.
Hola y bienvenidos a la iniciativa de las zonas de equidad sanitaria, nuestra sesión de descripción general del 20 de enero 2023.
While we wait for folks to join, staff is launching a Zoom poll to help us know who is in the room with us today.
Mientras esperamos a que las personas entran, el personal del Departamento de Salud va a lanzar una votación de Zoom para ayudarnos en conocer quién está asistiendo hoy.
Introduction of, okay. My name is Alina Swart. I am helping with facilitating today. I am calling from Clarkston, Washington. And I am a part of the sorry, I had a kid talking. The Community Advisory Council. And I am here because I care about the healthcare that people get. And I feel like there's a lot out there that are not getting what they deserve as a human being.
Good afternoon. My name is Olivet Foster, and I'm calling in from Seattle, Washington. I am a community worker at a community service organization, and I'm also part of the Community Advisory Council. And I am on this council as both a member and a provider.
Mi nombre es Alina Swart, estoy ayudando con facilitar. Hoy estoy llamando de Clarkston, Washington. Soy parte del Consejo Asesoría Comunitario y estoy aquí porque me preocupo por la atención médica que reciben las personas y siento que hay muchas cosas y mucha gente que no tienen lo que merecen como ser humano. Y buenas tardes, me llamo Olivet Foster, estoy llamando de Seattle, Washington. Soy un trabajador comunitario de una organización de servicio comunitario y también estoy parte del Consejo Asesorio Comunitario y estoy en ese consejo como miembro y también como trabajador de salud.
Okay, a little bit of housekeeping before we begin. Please click the link in the chat to fill out the sign-in sheet so we can stay connected with you after today's session. A staff member will be dropping that into the chat for us.
Ok, antes de que empezamos, por favor, haga clic en el enlace en el chat para rellenar la hoja de entrada. Así podemos quedarnos en contacto con usted después de la sesión hoy. Un personal del Departamento de Salud va a poner el enlace en el chat.
If you have questions throughout the presentation, please use the Q&A feature on the bottom of the screen or wherever it is for you. For me, it's the bottom. We will hold a questions and answers time at the end of the session for people to respond to.
Si tiene preguntas a lo largo de la presentación, favor de usar la función de preguntas y respuestas de Zoom. Vamos a esperar al final de la presentación para responder a preguntas.
This session will be recorded. The recording and slides will be uploaded to the Health Equity Zones webpage after this session. Staff will put the link in the chat for you. You can check that out if you'd like.
Esta sesión estará grabada. La grabación y las diapositivas serán subidas al sitio de web de las zonas de equidad sanitaria después de la sesión. El personal incluirá el enlace en el chat y puedes verlo si quieres.
Closed captioning has been made available to everyone here. It should say show captions with a little CC. You can click that in order to access that.
El subtitulado está disponible para todos aquí. Debe decir demostrar subtítulos con un pequeñito CC y puedes hacer clic ahí para accesarlo.
To access the Spanish interpretation for our Spanish-speaking participants, please click on the interpretation and select the language you want to hear. If you would like to hear the interpreted language only, click mute original audio.
Para acceder interpretación en español para los participantes hispanohablantes, favor de hacer clic en interpretación, y luego hacer clic en el idioma que prefieres escuchar. Si quieres solamente oír español, puedes hacer clic en Mute Original Audio, que dice enmudecimiento del audio original.
Okay, so we will begin the overview. So the first thing we'll talk about is how this initiative, this Health Equity Zone initiative was created. So the Health Equity Zones initiative was created by Senator Kaiser through Senate Bill 5052 and passed by the legislature in 2021 in response to the recognition that there are deep, long-standing inequities that exist across Washington, and that those who are most impacted by health inequities have the best understanding of the solutions needed to improve the health and well-being of those in their community. The legislation calls for an approach that focuses on the unique needs, solutions, and characteristics of a community. The Department of Health is supporting the selection of 3 initial zones as a proof of concept during this pilot phase of the initiative. Each zone will convene collaboratives with other community organizations to identify the health priorities within their community and the solutions that are centered in community-based driven decision-making.
As defined by the legislation, health equity zones are a contiguous geographic area that demonstrates measurable and documented health disparities and poor health outcomes, is populated by communities of color, American Indian, and Alaska Native communities, communities experiencing poverty or immigrant communities, and is small enough for targeted interventions to have a significant impact on health outcomes and health disparities. Since the Health Equity Zones initiative was established, community members have guided the development of this work and the interpretation of the definition provided by the legislature.
The graphic that you see on the screen provides an overview of the different phases of this work. Starting in 2021, the Department of Health launched phase 1 of the initiative, which included engaging and planning with community, tribal, and agency partners on how to develop the initiative. The Health Equity Zones initiative is currently in phase 2. During this time, the Community Advisory Council and Community Work Group were convened to guide the development of the zone selection process, which we will share more about later in this presentation. The Community Advisory Council gathered feedback from community members throughout the development of this process and will be responsible for selecting the health equity zones. After the zones are selected, the initiative will move into phase 3. Each zone will form their own community collaboratives to identify the health priorities and develop projects based on the unique needs of their community. The collaboratives will be made up of community members, community-based organizations, and social service organizations, also coalitions and other groups that are critical to ensuring the health and well-being of those living in their community. Phase 4 will focus on supporting the long-term stability and growth of the initiative with committed support from the Department of Health.
The Health Equity Zones initiative has been intentional about centering community at every phase, from planning to development and implementation. The community work group is an open membership group that provides input to inform decisions that the Community Advisory Council is considering. Community members are welcome to engage in the work group as it works for them. The Community Advisory Council leads decision-making about the development of the nomination process and selection of the health equity zones with feedback and guidance from the community work group. Members of the Community Advisory Council include 18 community representatives who were selected by other community members, 4 tribal community representatives, and 4 sector representatives from local health jurisdictions, accountable communities of health, and Governor's Interagency Council on Health Disparities. The Department of Health's role in the initiative is to provide technical assistance to the 2 community-driven groups that are guiding this work.
Across both the Community Advisory Council and the Community Work Group, there are members from 16 different counties within Washington State. 6 counties have members from the Community Advisory Council only. 2 of the counties have members from the Community Work Group only, and 8 counties have members from both the Community Advisory Council and the Community Work Group.
Next, we will talk through the process of selecting the zones and why your community may be interested in participating. What are the benefits of being selected as a health equity zone?
The key innovations of the Health Equity Zone initiative include community-driven funding, meaning that the community collaboratives in each zone will guide decision-making around resources to identify the health priorities and solutions that meet the unique needs of their community. Collaboration with neighbors and community through the community collaboratives, which will be built on collaboration across community-based organizations, coalitions, networks, local businesses, emergency response, public services, social supports, and other driving forces within a community. and it will have a focus on local solutions. This approach recognizes that people who are most impacted by health inequities are the closest to the solutions that will improve their health.
On the screen is a timeline of key dates regarding the selection of the health equity zones. The nomination form will launch on February 28th. After the launch, we will be hosting informational calls in March. While the form is open, staff will be providing technical assistance to interested communities. We will share later in the presentation about how Department of Health will support this process. The nomination form will close on April 7th. Afterwards, the Community Advisory Council will review and score nomination forms. Staff will compile the scores and create data profiles for the highest ranked nominees. The Community Advisory Council will review the highest ranked nominees and then select the zones. Zone selection will take place in early June. Afterwards, the selected zones will each convene community collaboratives and identify a backbone organization to support the logistics of this work. More information about technical assistance will be uploaded to the Health Equity Zones Initiative's webpage.
So what does nominating your community entail? With input from the community work group, the Community Advisory Council developed eligibility criteria to provide guidance to folks interested in nominating their communities as a health equity zone. Some of the considerations that went into our decision include alignment with project scope and funding, clear standard and expectations around the size of a zone, ensuring consistency and fairness in the Community Advisory Council scoring and review process, as well as formation of the community collaboratives. Let's see, the eligibility criteria is the Health Equity Zones Initiative will support communities in identifying pressing health concerns and building collaborative partnerships to address their unique needs. Community members interested in nominating their community as a health equity zone are encouraged to complete the Health Equity Zone nomination form. For communities to be eligible for nomination, they must meet the following criteria. 1, the community must be geographically defined. 2, nominators must indicate whether their community is either a rural or urban base on the definitions provided. Nominators must live in Washington State and have a demonstrated connection to the community being nominated. Those who work in Washington State seasonally or as temporary or migratory farm workers are also eligible. In this pilot of the Health Equity Zones Initiative, 3 zones will be selected. 1 for rural communities, 1 for urban communities, and 1 for Native communities. We will be sharing more about the zone dedicated to Native communities in a later slide. Definitions for the rural and urban zones were developed based on population density, as well as defining characteristics for each geographic area. Some examples of rural characteristics include difficulty meeting basic needs, such as food and housing, due to limited availability of resources, and limited access to culturally and linguistically relevant sources. Some of the examples for the urban characteristics are increased risk of disease outbreaks associated with population density and environmental contamination, plus close proximity to public transit, international airports, railways, and seaports. The characteristics included in the definitions aren't exhaustive, and it is not required that interested communities meet all of the characteristics. In alignment with the creation of the Health Equity Zones Initiative, the Community Advisory Council identified communities that will be prioritized in the zone selection process based on the deep impacts of health and equity. The zone selection process will prioritize communities most impacted by health inequities. This includes communities with significant populations that identify as Black, Indigenous, and people of color, also immigrants, migrant farm workers, refugees, and asylum seekers, also low income, the unhoused, and the under-resourced, those living with disabilities and mental illnesses, our elders, our seniors, the LGBTQIA+ population, and those having limited access to healthcare.
Zone dedicated to Native communities. In collaboration with tribal community representatives, Department of Health is supporting the selection process of a zone that is specifically dedicated to Native communities. Engagement with Native communities has been led by tribal community representatives on the Community Advisory Council. The process is ongoing and still being developed by tribal community representatives with Department of Health staff support. If you're interested in learning more about this zone pathway and engaging in the process, please contact us. We will provide our contact info at the end of the presentation and in the chat.
So what can you do to prepare for the nomination form launch? Here are some ways that you can start to prepare for the launch of the zone selection process in February. If you are interested in nominating your community as a health equity zone, please connect with your neighbors, partners, and organizations to brainstorm how you define your community. Also, identify any existing partnerships and opportunities to build relationships in your community, and identify your community's key characteristics, strengths, and challenges that you face.
Department of Health will be providing technical support to interested communities during the nomination process. This includes informational calls in March to provide a walkthrough of the nomination form, weekly office hours where people can drop in and ask staff questions. A schedule of office hours will be shared when the nomination launches. Support for alternative types of nomination form submissions, such as audio and video. We will also offer language support where communities can submit forms in their preferred language. We will also offer language support where communities can submit forms in their preferred language. Oh, I already read. Lastly, there will be relevant resources made available to support people in completing the nomination form. This includes links to data sources, resources on how to build a compelling narrative, map of rural and urban areas across Washington.
Thank you for joining us for this overview session. We would love to stay connected with you. Please contact us using one of the methods shown above. We will also drop the links in the chat for easy access. One way you can stay connected with us is to email us at healthequityzones@doh.wa.gov. Or you can visit our website at www.doh.wa.gov/healthequityzones. Or you may sign up for our newsletter, and there is the link on the page. We are now going to transition to our Q&A portion. And if you have any questions, please use the Q&A feature at the bottom of the screen to submit your questions.
questions can now be gone through? Are there any that we need to go through? If we don't get to all the questions, please feel free to email us and we will be sure to follow up with you. Thank you again for being here with us, and we hope to connect with you again soon.
Oh, I see a good question. It says 75% plus of American Indians and Native Americans also live in urban areas. So how will terms like tribal health zones also help those and help the urban natives? Okay. That was a very good question, and I may need some help with this. It may be a question that we may be able to answer later on. If you could please email that question.
I think we can answer it a little bit. Since we picked a tribal health zone, that is for anyone of tribal affiliation. And so it doesn't matter if they live in an urban or a rural area, that will cover them, depending on which community gets selected at the end after the nomination process. Does anyone else want to jump in? And
if it's okay, I can jump in really quickly.
Okay.
This is Bree. I just wanted to just echo that this is a really good question, and is something that we have been thinking about. So we have made a shift in how we're communicating about that zone. So the zone is dedicated to Native communities, which means that urban Native organizations and tribal community organizations would be eligible for that particular pathway for zones.
Thank you, Bree, for that answer. Are there any other questions? Please feel free to use the Q&A tab at the bottom of your screen.
if it's a question you're just not comfortable asking here, that's totally fine. Or would anyone like the chat feature turned on and you can ask that way? I think that's fine too. Or yeah, we could take live questions. We could make it so that people can unmute themselves and ask. I think that'd be great too.
If you're interested in learning more about the zone that we are dedicating to the Native community and engaging with the tribal community representatives leading the process, you may contact us at Health Equity Zone at doh.wa.gov.
Everyone is able to unmute and ask a question if they'd like to.
Okay. I'm not seeing anything in the chat, and I am not seeing anything in the Q&A.
I think the sign-in sheet is going to be dropped in the chat again. So if you'd like to stay in contact, please do put your information in there so that we can keep you updated on the process.
We will also be rebroadcasting this overview again on Tuesday, January 31st. So if you have friends or other community members who would like to receive this information, please pass that along.